Bill Riley, and B.H. Powell. Thank you very much for all the work that you do for us and for being here this morning and keeping us together. I would like to introduce our pages that are here with us this morning. We have Graham Adcock, who's sponsored by me. Representative Perret, thank you for being here. Happy to have you here. Brooke Hardister, Speaker Tim Moore, Addison Reich, Representative Dennis Riddell, and Bruno Rivas, Representative Ashton Clemens. Thank you very much. I hope you enjoy your day and learn a lot this week. Okay, so let's begin with our first bill this morning, House Bill 939. We do have a PCS for 939, and without objection, Representative Sasser moves to place the PCS for House Bill 939 before the committee. And I think we also have an amendment.
Yes.
Okay. Representative Crutchfield, I think, also has an amendment for the PCS for 939. Representative Crutchfield, you are recognized to explain the amendment.
Thank you, Madam Chair. This amendment is purely technical, as requested by the State Health, and if anybody has any questions, staff is willing to help us answer those, but I ask for your support in the amendment. Thank you.
Okay, Representative Crutchfield moves for the adoption of the amendment. All in favor will say aye.
Aye.
All opposed, no. The amendment is adopted. We are now back on the PCS as amended. Mr. Representative Sasser, Chair Sasser, you have the floor.
Thank you, Madam Chair. House Bill 939, access to transcranial magnetic stimulation. And I'm sure everybody on this committee knows everything about that, okay? Very simple, not complicated, deals with the brain, that explains it all. So, and I'm not qualified to explain that part of the bill to you, but I will explain what the bill tries to do or does and what the bill does not do. This is a bill about treating depression, and everybody on this committee and in the legislature for the last 2 years knows that this legislature has spent $1.4 billion on mental health. So this is kind of a continuation of dealing with mental health and trying to tie up some loose ends. What this bill basically does is allow general practitioners who see most of the patients in this country, in North Carolina, the primary care doctors, to allow this treatment to their patients. Basically, the way the law is now, only psychiatrists can use this particular treatment. And there's nothing wrong. Nobody has any problem with the psychiatrist, and it's not trying to take anything away from what they can do. It's just the fact that we just don't have enough of them. We haven't figured out how to clone Representative Baker and solve all the mental health problems we have in the country. So we're just wanting to allow the primary doctors to use this particular treatment. Now, talk a little bit about depression. 8% of the American people have major depression, okay? Things like bipolar, all the really severe mental health problems. 27% of Americans have been diagnosed with the depression, and 11% of the population has depression as we speak. This doesn't even get into when we talk about incident depression, where you hit a bump in the road, and we all have bumps in the road. Some idiot murders your mama. Those are things that cause depression, but we usually get through those issues and learn to deal with them. But this is a treatment, and we use primarily, especially us pharmacists, we use medication to treat depression. The reality is that only like 30% of people that take medications for depression are successful in treating their depression. This particular treatment has a 62% success rate. So all we're trying to do with this bill is try to make it more available. Now, we're not mandating that insurance companies pay for this treatment. I think I can say this, most insurance companies do pay for this treatment, but this bill has nothing to do with mandating who pays for it, who doesn't pay for it. It's just making the treatment more accessible to the people that need it in North Carolina. This has no scope of practice change at all. It doesn't change what a doctor can do, so on and so forth. It just makes this treatment where the general practitioner doctor can prescribe it for their patients. So at this time, I stand for any questions and ask for your support of the bill.
Thank you, Chairman Sasser. I will first offer questions from the health chairs, if there's any. Okay, and members of the committee. Representative Ball.
Thank you, Madam Chair. I'm just curious as to whether when this service would be prescribed, is the prescription supposed to go to any sort of person that can provide the service? I don't see that in the bill, but for example, does the prescription have to go to a psychiatrist?
No, ma'am. No, ma'am. Presently, the way the system is, and I don't know that there's a specific law saying that, but the way the system is, the psychiatrists are basically the only people that use this procedure presently. This bill will, for lack of a better word, advertise that primary doctors, general practitioners can use this particular treatment without having just a psychiatrist to.
Follow up. Just want to make sure I understand. So the primary care physician can actually do the procedure?
Directly, yes. Well, can have the procedure done. They don't, to my knowledge, and I could be wrong here, they don't specifically on the machine that does it. They will send the patient to have that procedure done. Yes.
Okay, thank you.
Representative Cunningham.
Thank you, Madam Chair. Representative Sasser, I noticed inside of the bill that it is not specifying like for major depression, severe depression, level of treatment. I know you said that if someone goes in with minor depression, they most likely wouldn't be doing this treatment. But for major and severe, you would expect that they would have the option for the treatment. But it doesn't specify.
Okay, reading my points here, an independent study of one particular TMS device demonstrated in 62% remission rate in treating major depression disorders.
Representative Reeder, you are recognized for a question.
Thanks for this bill. It's interesting. I've been learning a little bit more about this. How many of these treatment centers, machines are there in North Carolina? Do you have any idea right now?
No, sir, I'm sorry, I do not. I can get that information for you, but I do not.
Follow up. So the primary care physician would refer this to some center with which to do it. Is there any concerns or anything that would prohibit primary care physicians from employing or buying one of these machines? Do we know about the cost? Would it fall under CON or anything like that? Just thinking about self-referrals.
I don't have and it would be an opinion. I don't have any facts along those lines. It would be my opinion. Number one, probably would not be cost efficient, probably be cost prohibitive, and I'm not aware of any primary care doctors or even psychiatrists that do this treatment individually. But I'll check on that, touch back with you.
Representative Crutchfield, you are recognized for a question or comment.
Just a motion when appropriate.
Representative Servania, you are recognized for a question.
Thank you, Madam Chair. It does specify in the bill that the referrals would go to a qualified health facility and a certified or qualified health professional, correct?
That is correct. And we do have these providers in North Carolina. Again, not sure how many. I know there's not a lot. And this is not a frontline treatment. Most people with depression are started out on medications, but would be second line therapy. So.
Yes, sir. And follow up?
Follow up.
I just wanted to confirm, but I'm just trying to help out my colleague here, that I just looked it up and a machine costs approximately $80,000. So the question is valid to whether there could be self-referral. At the same time, I think it looks like, and you can confirm with me, Representative Sasser, that you need to be a properly licensed healthcare provider to order, perform, and supervise this treatment.
That is correct, yes.
Thank you.
Are there any other questions from the committee? Seeing none, I do believe we have some members of the public that have signed up to speak on this particular bill. So I will open up public comment and call on Mr. Peter Daniel, please, to go to the podium, and you have 2 minutes.
Chairman Paré, honorable members of this committee, Representative Sasser. My name is Peter Daniel. I am the Executive Director of the NC Association of Health Plans. Our commercial members cover the vast majority of insured North Carolinians. I appreciate the opportunity to bring comments concerning House Bill 939 this morning on behalf of those insurance companies. In polling the commercial members of the association, the vast majority, as Representative Sasser said, of commercially insured citizens have this procedure as a covered benefit. If the goal of the legislation is to increase the types of practitioners licensed to provide TMS, we recommend that the bill should be housed in Chapter 90, not Chapter 58, as it is intended to regulate providers, not insurers. After review, we believe the language as written seems to be counter to the stated goal of getting more providers to offer the service. While we appreciate the attempts to improve the bill, it is misplaced in Chapter 58 and not sufficiently clear that insurers will not be penalized if they continue to cover treatment. In fact, we believe the current language as currently written is so unclear that it may force insurers to avoid coverage altogether to escape potential penalties. Most, if not all, insurers already cover TMS, and this bill could have unintended consequences and jeopardize this treatment for individuals who desperately need it. We are happy to work with the bill sponsors and bill advocates to perfect the bill. Thank you very much.
Thank you very much. Next on the list is Tammy George to speak on this bill, House Bill 939. If you are here, Tammy, please go ahead and head up to the podium and the microphone. And you are recognized to make 2 minutes of public comment.
Good morning. I am Tammy George, and I'm privileged to be here as a patient advocate for Transcranial Magnetic Stimulation. I have had this treatment. I'll try to do this in a Reader's Digest version. I've had a life of trauma starting at age 4. And at age 48, 2 life events pushed me off the cliff. I had sought help from my general practitioners for many, many years, like from age 18 on, for my clinical depression. At age 48, I had a nephew to die in my living room, and my daughter disappeared. Without transcranial magnetic stimulation, I'm gonna cry, I would have been institutionalized. Thank God I was in a psychiatric practice that knew about TMS and got me in the system quickly. Had my general practitioner or my primary care physician known about this, I could have gotten help and been the woman that I am today. My business is thriving, my family is thriving. All of that came 20 years later than it should have if someone younger or someone in a different setting other than a psych setting could have helped me. I wear a t-shirt all the time that says "In the Stigma." People talk about sinus infections and cardiovascular events all day long, but when you stand and you talk about bipolar and depression, anxiety, all these things, you're labeled with a stigma. I own a multi-million-dollar consulting firm, and to be labeled with a depression diagnosis when you walk in these places is unheard of because people look at you differently. Had my general practitioner had access to this 20 years prior, I cannot tell you where I would be currently as a woman, as a business owner, as a native North Carolinian, as you can probably tell from my accent. I firmly believe in this therapy. I felt a difference within 7 days of starting after suffering since age 4 at age 48. So please reach deep down in your hearts and think hard about this. It's a no-brainer for me because I've lived it. Thank you for your time.
Thank you very much, Ms. George, for sharing that with us. The next speaker is, I'm not sure I can read the last name clearly, so I'm just going to say James B. I'm sure you know who you are. Thank you. Please step up to the microphone. You have 2 minutes.
Hello, my name is James Bliziotis, and I'm here representing Neuronetics, the leading TMS manufacturer here in the United States. My sole job at Neuronetics is to expand this treatment to as many patients as possible, expand health policy, reduce barriers, and make sure that the patients that are in desperate need of this help have access to care. Like many of you here, 3.5 years ago, I had no idea what transcranial magnetic stimulation was. It's through interacting with patients like Tammy and patients all across the country that we've come to see the importance of what this does for the continuum of care for these majorly depressed patients. You can't help but think about those that you know personally, and I go back to my brother who has battled depression his entire life, who the nearest TMS center is more than an hour and a half away. The nature of this treatment requires patients to go in 36 times, 5 days a week. And to travel an hour and a half would put his job in jeopardy, and he's had to make the choice not to do this treatment and to get better in order to save his own job. Now, if his primary care physician, who I might mention is actually treating him for major depressive disorder, could actually perform this treatment, it would be life-changing for him. So thank you again for letting us speak on House Bill 939, and we hope that you take this into consideration seriously.
Thank you, Mr. Bliziotis, for speaking today. We thank you for sharing those comments with us. Okay, now we will move to a motion. Representative Crutchfield moves for a favorable report to the PCS for House Bill 939 as amended, rolled into a new PCS, unfavorable to the original bill with a serial referral to House Appropriations. All in favor will say aye. Aye. All opposed, no. The ayes have it. And the bill passes to Appropriations.
Thank you, Madam Chair. Thank you, committee.
Okay, we'll move to the next bill, House Bill 1029, Right to Try Individualized Treatments. This again is a PCS The committee members will recall that House Bill 1029 was before the committee last week for discussion purposes only. And without objection, Representative Chesser moves to place a PCS for House Bill 1029 before the committee for discussion purposes. You have the floor.
Thank you, Madam Chair. Committee members, you guys, we had a pretty robust debate conversation. I appreciate that last week. PCS is fairly straightforward. Some of the concerns you guys brought forward were addressed with the PCS. We added a couple definitions and make some people in the back pretty happy. We added an explicit exemption, making sure that Medicaid would not be forced to pay for this. Any questions?
I will first look to the health chairs for any questions. No. Seeing none. Committee, are there any questions from the committee? No questions from the committee. Wow. Okay, then we will move to a motion. Well, first I should ask if there's any comments. Anybody signed up for public comment for the 1029? I didn't see that. Okay, moving for a motion. Representative Reeder.
Move for the favorable for the PCS, unfavorable to the original. If I got
For
it right.
House Bill 29 and a serial referral to House Appropriations.
That too.
Okay. Thank you. With a motion on the table, all in favor say aye. Aye. All opposed, no. The ayes have it. The bill passes. Thank you, Representative Chesser.
Thank you, Madam Chair.
Thank you very much. That concludes our agenda today for House Health. Hope you have a great day and see you next time. We're adjourned.